Pain is not always bad. Pain needs to be managed, but pain is something that is our body's natural way of expressing itself and saying, hey, you need to slow down, you need to take care of me, and you need to make sure that this is managed. Pain was declared as the fifth vital sign from the American Medical Association. So that's been something that's so interesting because, one, it's a great recognition that pain is an important factor in the healing process, but when doctors are taking your pain levels, they're being judged also on making sure that you have the least amount of pain. And if they're being judged on pain ratings, that can be a big problem because they have different motivations to be able to keep people out of pain. One of the problems that we face with that is that traditional medicine, we have gone through and immediately gone to opioids. They are highly addictive and have been overlooked and overprescribed for decades. We know that you can get addicted to opioids in as little as 6 days. So this is a real problem. We have one of the largest opioid overdose rates in the country, and this is something that we need to be making a big difference on. So one of the things that I'm looking at right now are physician prescribing practices. How much is actually being prescribed? Are they following CDC guidelines for chronic prescribing? How are we doing with making sure that we have taper plans, looking and making sure that physicians are giving the least prescribed that's necessary, clinically necessary, and making sure that we're screening people because not having enough pain medication can be a huge difference too. One of the studies that I did showed that only 7% of charts are screened for opioid use and opioid use disorder in a pre-hospital setting. So this was specific in surgical practice. So before you go to surgery, many patients weren't being screened. Well, if you're a recovering opioid addict and you suddenly are having opioids reintroduced at high levels, this can cause respiratory failure. This can cause so many other problems for patients, as well as be a potential catalyst for opioid addiction again. Also, one of the studies that I just did here at UVU is looking at athletes because we know that very chronic injuries can happen with collegiate athletes, and we're making sure that they have the resources necessary, that they are taught the skills to do pain management so that they aren't just turning to pills and becoming addicted, because some injuries can be lifelong. And even after you're out of the college setting, having resources and knowledge to be able to take care of yourself after is incredibly critical. I firmly believe that our trials make us authentic to the needs of others. At age 5, I was diagnosed with Ewing Sarcoma, which is a type of bone cancer. And as a 5-year-old, I had to undergo lots of different surgical procedures. I've had over 42 surgeries, spinal and otherwise. On one of my surgeries when I was a lot younger, they did a spinal fusion, and I was given too many opioids, and it's too high of a prescription, and my body did not metabolize it, and I ended up in respiratory failure and a coma. Since then, I have had to go where I can't have oral opioids. And I've had to have surgery since then. And I've worked with brilliant people and pain management specialists that have been wonderful in working with me in my situation and saying, hey, you know what, there's a lot of alternatives. So going through chemotherapy, being sick, going through radiation, all of these things were kind of a catalyst for me in wanting to discover more about this. I learned a lot about the resilience of patients. I learned a lot about how patients can be advocates for themselves, how patients are able to really speak up and say, hey, yes, I do have pain, but I don't necessarily need to feel terrible the entire time on opioids or whatnot, that there's ways to manage that. So all of us are going to have to grapple with this world of healthcare and health insurance. And having health insurance literacy is important. What is the difference between a high deductible and a low deductible? How is that going to affect my health? I'm a fairly healthy individual, but what if I have a traumatic event? What if I have a car accident? How is that going to affect? Is that going to actually make me go bankrupt because of this. I just did a study here at UVU about that, and it was amazing because so many students identified that they were interested in this, that they were overwhelmed by it, and that they had a great lack of knowledge in this area. I think it's an incredibly important topic. So I harp on it way too much in my classes, but I want them to know and to be aware and to be educated about this. I love this opportunity to work with students, really being able to see students take concepts and understand them, and being able to see the amazing potential that they have, and to see where they're going to be able to end up, and the differences that they will be able to make in the lives of others is so rewarding. Even if it's not a difference on a systems level, even if it's a difference for one patient, that's worth it.